Now, rotator cuff tendinopathy can be a very common and debilitating condition, especially in people who do repetitive activities like construction work or lifting. Now, I want to show you what the symptoms of rotator cuff tendinopathy are so that you can recognize it for yourself. Hi, my name is Dr. Joseph Rosie. I'm a licensed physical therapist, and in this video, I'm going to teach you how to identify the signs and symptoms of a condition called rotator cuff tendinopathy. It's not as easy as just going to your doctor's office, but if you know what to look out for, then it becomes really simple. So let me show you these common signs and symptoms so that you can get them taken care of before they become worse. So, what are the symptoms of rotator cuff tendinopathy? The most common symptoms of rotator cuff tendinopathy are 1. Pain that is worse at night or after activity. Now, this is due to chemical changes happening from the activity that is irritating the tissue and a buildup of these chemicals at night. The pain is most often felt along the top of the shoulder where the tendons attach and can radiate down the arm. 2. Swelling and warmth at or around the shoulder joint. 3. Weakness in moving parts of the shoulder in the area, such as turning your arm over outwards or lifting it above your head. 4. Stiffness in your shoulder and or clicking and popping sensations. 5. Numbness and pins and needles. 6. Pain that wakes you up from sleep, especially if your movement during the night irritates it further. For example, by lying on your side or rolling over onto it while sleeping. You may lie awake at night and find yourself unable to get comfortable because of the pain or numbness from lying on your affected shoulder for far too long. 7. Your shoulder may have stiffness and pain first thing in the morning when you get up. This stiffness eases a little after activity or movement, but tends to worsen again after rest, especially if resting your affected arm hanging down straight by your side. So, who is more likely to develop rotator cuff tendinopathy? Now, a person is much more likely to develop rotator cuff tendinopathy if they have an underlying shoulder weakness or imbalance present before they start doing a new or frequent repetitive movement, especially with excessive overhead activity. Now, excessive use or repetitive movements of the arm can lead to rotator cuff injuries, and certain types of activities are more likely to irritate the tendons. Now, people have a higher chance of getting rotator cuff tendinopathy if they're in an occupation such as working in a building, in an industry that, individuals are lifting heavy objects, that they're doing this for repetitive use, especially when they're using their arms a lot. Their workstations are usually small and cramped, making them very vulnerable to this injury. Think like manufacturers or assemblers or who are exposed to machinery with repetitive movements all day long. Those who are using vibrating tools and equipment at work on a daily basis, so think like electricians or carpenters, or occupations requiring repetitive overhead movements such as any kind of construction job, again, assembly line, painting, electricians, you name it. Now, there are certain types of sports as well where people have a higher likelihood of developing rotator cuff tendinopathy. Sports with a high repetitive stress and load placed upon them on the shoulder, especially the rotator cuff muscles. Now, so think like basketball, tennis, swimming, football, volleyball, and rugby. So, how do you know if you have a rotator cuff tendinopathy? Just because you have some of the above symptoms does not mean that you necessarily have it, right? There are many shoulder and neck issues that can mimic the rotator cuff tendinopathy. So, the best way to know if you have rotator cuff tendinopathy is to get assessed by a physical therapist and have them lay out the best course of action for you. Now, it's important to rule out other conditions that can mimic a rotator cuff tendinopathy. For example, muscles and nerves in the cervical region and shoulder can refer pain to places that may seem like your rotator cuff is involved, when in reality it's not. Also, if you're experiencing pain in two different parts of the shoulder region, then there could be two problems that need to be addressed. Sometimes specialists focus on one of those areas in particular when diagnosing injuries, and they don't tend to look at the surrounding areas that really may be contributing to the problem. Now, physical therapists are very good at looking at the whole body or region and truly addressing what is going on. So, if you're wanting to skip the frustration and not know what is causing your pain or potentially trying to treat something that is not the main culprit, a physical therapist is the best person to see. The good news is if you think you have this and you focus on doing some of the things we're going to discuss in the next video, it will help you recover or prevent you from ever having it in the first place. So stay tuned for the next video to dive further into what you can do at home. Thanks for watching, and if you haven't already, be sure to subscribe to the channel and tap the bell so you don't miss another video. Thanks again, and I'll see you in the next video.